Hello, and thank you for joining us in this latest screening by the Health Pro Tips channel, where we bring you the new and breaking health tips so you can be aware, be safe, and be healthy. Before we begin, we would like to say that if you are looking forward to the content and you have not yet subscribed, go ahead and slam that red subscribe button below to subscribe to our channel, and then tick the bell icon to be notified of all future videos that we upload and when we upload them. Also, go ahead and give me a thumbs up sign showing you are excited for the content and looking forward to it. So without further ado, let's go ahead and dive straight into the content. So in today's video, we're going to discuss the novel coronavirus, which is now a global health emergency, and bring you important information on top 10 things you need to know about this deadly virus. As you have likely heard, the novel coronavirus has emerged in Wuhan, which is a city in the Hubei province of central China. This virus goes by many names like corona or coronavirus, but this most recent strain is called the 2019 novel coronavirus or 2019 nCoV. Coronaviruses are a large family of viruses that include the Middle Eastern respiratory syndrome or MERS that originated in Saudi Arabia and the Middle East, or the coronavirus that causes severe acute respiratory syndrome, also known as SARS, which began in Hong Kong. While SARS totally went away after about 8,000 cases and about 800 deaths, the MERS virus is actually still out there. Hence, we all need to be knowledgeable and informed about those deadly strains of viruses. Now, initial studies show that the virus was transferred from bats to humans. This, however, is a new type of coronavirus which has never been seen before in humans. So on January 30th this year, the global emergency was declared due to the significant rise in the virus cases. The World Health Organization, or the WHO, met at a press conference in Geneva, Switzerland, where it declared the situation to be a global health emergency of international concern. And then a few days later, the United States declared their own coronavirus as a public health emergency and has put in place policies and procedures to protect citizens and residents from this deadly virus. The coronavirus outbreak continues to spread and has now infected tens of thousands of people and claimed several hundreds of lives, all in China as of this recording. Now, coronaviruses are respiratory viruses that can cause illnesses ranging from common cold to severe pneumonia. But other symptoms are things like respiratory discomfort and shortness of breath. You could have fever, and in some cases even mild to cold symptoms. But during the flu season, hundreds of patients are seen for respiratory symptoms similar to what is quite common with the coronavirus. So doctors and clinicians treating these patients need to be extremely careful and not confuse a simple illness like flu, for example, with a life-threatening one like the coronavirus. Now, the other question that comes up quite often is the coronavirus contagious? And the answer is yes, it is contagious. And how does it spread? How is it spread? Principally by droplets and by physical contact, and that occurs when a person is sick with this virus, coughs or sneezes, or in close proximity to another person. In addition, people with pneumonia caused by nCoV are likely to be more infectious. Many of the patients in the outbreak in Wuhan, China, reported that there was some link to a large seafood and animal market, suggesting there was animal-to-person spread initially. Now, however, a growing number of patients reportedly have not even had exposure to animal markets, and that indicates more of a person-to-person spread is occurring. So where is the epicenter for these viruses? The 2019 novel coronavirus broke out in Wuhan city, as we said, in Hubei province in China in a market. Now, according to the Center for Disease Control, or the CDC, it began in December 2019. The Wuhan city outbreak has been epidemiologically linked to a large seafood and animal market, and the market has since been closed down since January 1st. The city of Wuhan is, however, on a complete lockdown. There is no travel in and out of Wuhan. And while the virus itself is widespread in China, there is no specific vaccine or specific treatment available yet for the 2019 nCoV infection, and the clinical care is supportive. What is being done in China is that the Chinese military is now assisting with not only providing law and order, but also to assist with food and medical supplies. Interestingly, drones are being very creatively used in these rural areas to battle the coronavirus. So, for example, drones are used for medical supply delivery or to drop announcements to people. Drones are interestingly also used in other areas to monitor whether people are wearing protective masks. And what else is China doing? Well, there are tens of thousands of such patients with coronavirus, and they definitely need all the hospitals they can get. So what China has done is they built a brand new hospital in Wuhan to isolate and treat these patients, and they did it super fast. Within 10 days, they started building on January 24th and were done building the hospital on the 2nd of February. That's pretty fast. And they started accepting patients the very next day on the 3rd of Feb. Now, one thing to note is that admissions are only for patients with officially confirmed coronavirus infections who are transferred from other facilities. This, I think, is a giant step in that direction, because you can have a hospital for new patients without affecting other patients already using existing hospitals. Here, the Center for Disease Control shows a nice little heat map of countries with confirmed cases of the virus. China, where this virus originated in a market in Wuhan, is obviously the most widely affected. There is currently some confirmed cases in many other countries, and the USA Center for Disease Control and Prevention (CDC) is also screening passengers arriving from China to the United States. There are approximately about 26 other countries that have reported confirmed cases of illnesses due to the virus, including Korea, Germany, USA, Australia, Singapore, UK, Japan, and a lot more. Keep in mind, all these numbers may be much higher in the next few days or weeks or months. So when we look at pure numbers of casualties, you can see there are many casualties in China itself. Although the coronavirus cases are over 10,000, the deaths are more than 250 at the moment, and that's a pretty high number. As of this recording, hundreds of people have lost their lives due to this deadly virus, and the number of cases are rapidly increasing. Here are some very specific cases in graphs showing the cases reported worldwide and the total deaths, and most of them or all of them at the moment being in China. As you can see, from the middle of January, the 21st or so, up to the end of January, you see the steep rise in the total cases reported worldwide, as well as in the total deaths that are reported. And then here we see some really chilling numbers. Here, this is the most recent numbers from an article from Dan Rubitsky in Futurism.com, and that shows much more appalling numbers from the Wuhan coronavirus, going up to the mid 400s. And again, this number may also be higher once you get a chance to view this video. So what are hospitals and clinics doing, right? So hospitals worldwide are closely watching as their health officials in their countries have learned that the virus can be spread by contact with an infected person. So at registration of patients or during admittance to a clinic, patients should be asked very specific questions or should be even tested for following items. So for example, if patients are being admitted, they should be checked for artifacts like have they traveled to or visited or transited within China in the last 30 days? Have they reported symptoms of cough or respiratory discomfort? Do patients have fever or close contact with a person that has traveled to China? Have they had close contact with someone that had the nCoV virus? Patients should be treated in closed-door rooms. And what that means is, if a patient is being treated, you shouldn't, because these are airborne viruses, they shouldn't be affecting other patients that are being treated in nearby rooms. Hospitals are trying certain special screening at the moment, where they're integrating screening for the nCoV virus into their electronic health record systems to ensure that any potential patient that walks into their facility is covered. They're also informing and educating their staff and emphasizing about respiratory viruses, and they're focusing efforts to support their patient facilities. Now, one thing I wanted to mention about the word close contact is close contact can typically include things like caring for someone or living with someone or visiting or sharing a healthcare waiting area or a room with a patient with the novel coronavirus illness. So this can also include being coughed on while not wearing protected equipment. Healthcare professionals caring for any patient with acute respiratory decline must make sure that they're wearing protective gear when near to or treating a patient that is affected with the virus. The Center for Disease Control recommends that clinicians must wear an N95 respirator. They should also be wearing effective eye protection. They should be wearing gloves and also be wearing protective gowns. Now, there's rumors, and it might be true, that certain face masks, certain models of face masks are not available or they're sold out. And so the advice is to head to your local drugstore or pharmaceutical store and look for surgical face masks that you can use. We're also advising folks to cover their mouth and nose with a tissue or sleeve, so that way, when you're coughing and sneezing, you're not either affecting others. And that information was for clinical stuff, but what about non-clinical stuff? Well, this protection goes both ways, right? So, or always actually. It's very important to remember that you can do your part to help stop the spread of germs without proper coughing and sneezing etiquette. So be sure to wash your hands with soap and water or an alcohol-based hand sanitizer after coughing or sneezing. Hand hygiene is paramount, not just now, but at all times. Make sure you cover your mouth and nose with a tissue when you cough or sneeze. Make sure you put your used tissues in a wastebasket or a rubbish bin. If you don't have a tissue, cough or sneeze into your upper sleeve, but not in your hands. Coughing and sneezing etiquette is especially important for infection control in healthcare settings, such as emergency departments and doctors' offices and clinics, but it is also important at home or anywhere outside that your patients exist. So what are the treatments that patients can have? So people with severe illness are typically being admitted with milder cases and may be seen and sent home. There are no known vaccines or medications available yet. And if you feel you may have the virus, please seek medical care right away. Also avoid contact with others by living or trying to be in a separate room. Cover your mouth and your nose. Now one thing that we advise patients is please call the hospital or the clinical unit before you visit them, because that way they're prepared to accept you and to treat you and to nurse you accordingly. And you're also not in a waiting room where there's other potential patients that could get the virus. The next thing we want to look at is travel advisories, events that are occurring in certain travel conditions. We look at the CDC has a level 3 warning, and that means that the CDC recommends that travelers avoid all non-essential travel to China. So travel to China should be reconsidered for the near future. Airport screening, however, may also be implemented. In the United States, there are 5 major airports that perform screening for travelers coming from China for the virus. The San Francisco International Airport, the Los Angeles International Airport, and JFK. And the reason these 3 airports are listed is because they have direct flights from Wuhan in China to these cities. O'Hare International in Chicago, as well as Atlanta's Hartsfield-Jackson International, are both hubs, and so those are also increasingly screening travelers. There's other travel conditions that we've heard of recently. One is there's a cruise ship in Italy which is under observation because 2 of the 7,000 passengers were treated for coronavirus. There's also a cruise ship in Japan that's quarantined off the coast of Yokohama, and that's because there were 10 people that were found to have symptoms of the coronavirus. Russia, on the other hand, has closed their border with China temporarily to prevent the spread of this disease. There's some additional US travel advisories. So any US citizen returning to this country who has been in Hubei province in China during the previous 14 days will be subject to 14 days of mandatory quarantine. Also, any US citizen returning from other regions of China within the previous 14 days may undergo healthcare screenings at certain select points of entry, and they may be subject to up to 14 days of monitored self-quarantine. And recently, the US President Trump has also signed a proclamation temporarily suspending entry into the US of any foreign nationals who pose a risk of transmitting the virus. So as a result, foreign nationals other than immediate family of US citizens or permanent residents who have traveled in China in the last 14 days will be denied entry at this time, temporarily. Now, there's a lot of impact to the financial markets when something like this occurs. And so, due to the global spread of the epidemic, the stock markets are affected due to the coronavirus panic from the death tolls in China. Usually, in this case, what traders do is they'll take a risk-off approach during this time. You will also notice because travel is suspended or travel has been aborted, travel stocks also get affected. And these are just some of the top 10 findings that we wanted to make sure that you are well aware, both from a healthcare perspective, from a travel perspective, from a precautionary perspective, as well as an overall understanding of how the coronavirus is affecting everyone in the world today. So we want to thank you for watching this video. We hope you can subscribe to our channel, leave comments, As always, don't forget to like this video. We'd like to keep our videos short and sweet, especially with PowerPoints. Please, if you like it, give it a good like if you like this video, and be sure to send in your questions by leaving gracious comments below, and we'll be happy to review and respond at the earliest. We want to thank you. We want to say be aware, be safe, be healthy, and with best wishes from the Health Pro Tips channel. Thank you very much. Bye-bye.